Well, hi, everybody. Susan Fleischman with ZTV here in our continuing series for Spring to Action 2021, which is coming up in just 2 weeks from today, as a matter of fact. And today I'm joined by some of our community leaders on some of the nonprofits in the area. And we're going to be talking with them today just about how COVID has really put a clink in their plans and in the charter for what they try to do for their constituents, and how Spring to Action kind of helps them overcome it. So I'm going to let our guests come on and speak for themselves. So Patrick, why don't we start with you? If you could just introduce yourself and tell us a little bit about you and your organization.
Thank you. Yes. Hi, I'm Patrick Brennan. I'm the Executive Director of Communities and Schools of Northern Virginia, CIS of NOVA. Our organization partners with Alexandria schools and Arlington and Fairfax schools. Our mission is to surround students with a community of support to keep them in school, to empower them to achieve in life. So wraparound services, both academic and non-academic, depending on what the needs are for the particular students in the particular schools that we serve.
Terrific. And let's see. Bassam Khan from Neighborhood Health. Hello and welcome.
Hi, everyone. Thanks, Susan. It's great to be with all of you. I'm Bassam Khan, a primary care physician and executive director at Neighborhood Health. We're a nonprofit organization, a federally qualified health center that provides primary care in Alexandria, Arlington, and Fairfax County, primarily to our low-income and underserved residents. And that's our focus, expanding access to care for the neediest and underserved among us.
Wow, that's great. And so, God, we know that you have been unduly affected by everything in the pandemic as well. Thank you so much for coming on the show today. Jennifer Ayers of Alive, can you tell us a little bit about Alive?
Sure. I'm Jennifer Ayers. I'm the executive director at Alive. We're an interfaith organization based here in Alexandria since 1969, and we provide basic needs support to people in need. So that can come in a lot of different forms, from food support to financial assistance, housewares, furniture, and even early childhood education.
Okay, terrific. And I just want to weigh one quick word to the viewers. If anybody's watching and has a question or wants to make a comment or has a question for Patrick or Bassam or Jennifer, please don't hesitate to go ahead and write a comment in the Facebook comment and we'll get your question answered. Let's see, Patrick, I'll start with you, or continue starting with you. Why don't you tell us a little bit about how, COVID-19 has really, hurt your organization?
Well, I mean, our name kind of gives it away a little bit. I mean, our model really is to sort of use schools themselves as sort of a hub for resources for students. So I place full-time coordinators in the schools. So when COVID came, the schools closed, and so for us, our challenge was to really meet the sudden needs and challenges of our families and students that didn't have that hub anymore. So all my site coordinators went out and started working outside the building, working in the community, to make sure that our families and students stayed connected, not only to their education, but also to the resources that were coming out to help everybody kind of weather the storm here.
Gotcha. I'll go to Jennifer next. Can you kind of talk to how COVID has kind of hampered your efforts?
It just changed things radically. So first of all, we started to see an increased need in people who really needed food assistance. And we had to really think about how we were delivering food and financial assistance in different ways because of the contactless environment that we now operate in. So we had to scale up operations significantly. And really think about how to partner with different organizations, with the city, with a lot of other nonprofits to be as efficient and effective as possible in delivering our resources to the people who needed them where they were. So it took a lot of coordination early on, a lot of scaling, a lot of resources to do it all. Just to give you a sense of scale, we started last year before the pandemic. We would do an average of about 30,000 pounds of food per month. We hit almost 200,000 pounds of food recently, and we've done about 1.5 million pounds of food from March of last year to December of last year. So that doesn't even include January and February this year. So our food program really expanded. And our early childhood education program changed radically. For 42 years, we operated an early childhood center at our main location, and we had to close that because of COVID. And we're trying now to rethink how we can engage in different ways in the early childhood community. So now looking at something we did over the holidays, collecting learning tools that we can provide to other preschools for their children to use in that virtual learning environment. So we've just switched a lot. We've had more need and really just had to switch gears and be responsive.
Wow. It never fails to amaze me, the creativity and innovation that people have come up with in getting the work done that needs to be done. Bassem, let's go to you. What can you talk to us about how COVID has affected what you guys are doing and how you guys are kind of working around that?
As you can imagine, Susan, COVID has significantly impacted our organization in many different ways. You've probably heard, but the COVID-19 pandemic has disproportionately impacted communities of color, low-income communities, who are our patient population. And early on in the pandemic, when we started testing, we realized and we saw that our patients were testing positive at twice the rate of the regional averages. So the people that we serve have been impacted. They've come down with COVID. Obviously, the economic consequences have been significant. So it's been difficult for a lot of our staff and a lot of our frontline providers to see their patients being impacted so significantly. The other piece of that, of course, is the requirement and the need to keep our staff safe while continuing to be able to provide critical healthcare services. And that has been a goal from the onset. Obviously, unless your staff are safe and they feel that they're safe, it's very difficult to be able to do anything else. So while ensuring that we're providing services to our patient population, many of them who really rely on these services, especially in this time of crisis, we've had to make sure that we're able to do that while continuing to keep our staff safe. So continuing to provide primary care services. In addition, doing additional things that are required of us during the pandemic. And two big components of that are, of course, first, COVID testing, being one of the places in the community where people without health insurance, people who are low income, a lot of the communities that we serve are able to get tested. And then, of course, more recently, being able to provide vaccines to the same communities who we've noticed and we've read have been vaccinated in lower numbers across the country. So it's been a responsibility on our shoulders to ensure that there's more equity when it comes to testing and more recently when it comes to providing vaccines.
Yeah, you do have the weight of all sorts of angles of this pandemic on your shoulders, Bassem. How has the funding from Spring to Action helped you kind of meet some of those objectives?
For us, we were.
Back to you.
Right.
Oh, I'm sorry. I was going to start with Bassem. Yeah, go ahead.
So, for us, it's been incredibly important, especially our funding from Active for Alexandria and the Emergency Fund in the early days of the pandemic to be able to make changes immediately to change our workflows, to change sort of the physical infrastructure, if you will, erect barriers, and make other changes to our facilities in order to keep our staff and patients safe. We had to make significant changes early on in a matter of days and to ensure that we're able to continue providing services, but at the same time ensure safety. It's been a long time since the beginning of the pandemic. For many of us, it seems like a lifetime. But if you go back to the early days and put yourselves in your own shoes or in the shoes of others back in those days, there were a lot of changes that we had to make early on, and that included erecting physical barriers, changing the density within our clinics, and then a big shift towards telemedicine, so being able to provide a lot of services virtually. And funding that we received from Act for Alexandria and the community in general really enabled us to be able to continue to provide the services that we provide. And that's been really important because the very people that we're serving are the same people who've been impacted most and who need our services most. So it would not have been a good time to cut back on services or stop providing services. So for us, the funding has been really, really important, and we're grateful to the community for that.
Oh yeah, that's great. Yeah, I can really see how um, those the telehealth capability is really, I think, one of those aspects of the pandemic that I think a lot of people hope is going to stick around because it's so convenient for people, and less sick people going into a public office and that kind of thing. And I mean, it's obviously not a one size fits all, but I think it's a good improvement. I'm glad to hear that it's been helping you and your organization and your important work over there. Jennifer, I didn't mean to cut you off before. Can you
Oh, no.
speak to Alive and how Spring to Action has kind of been a lifeline for you guys?
It was a huge lifeline. So, Spring to Action came earlier last year and it was accelerated. And ACT was also one of the first organizations that called us to see what they could do. So, it really helped us scale and get the equipment that we needed to do our job. So, prior to COVID, we would have people come to a place to receive food. And we've had to really move all of our operations to be contactless, which meant more trucks, more people, but less contact. So we've had to really shift how we have food prepared so that it can come literally off a truck and into someone's car or on a table where someone can stand 6 feet away and take it. So that was an incredible amount of logistics. And just having Spring to Action at that time helped us give voice to what we were facing and let the community know that they could respond and they could help. So we were really pleased with the turnout last year. And it just really shows how much the community cared about what we were doing and understood that that need that we were facing was growing. A lot of the same patients that I'm sure Bessim are serving at Neighborhood Health are also a lot of our clients. So having the partnerships through ACT and through the city just also really helped us make sure we were getting food to people who really needed it. So hearing, hey, we need groceries, we're doing an event, we would just bring groceries. So just that awareness really helped us tell our story and bring in the resources that we needed to do the work quickly.
Yeah.
Yeah.
Yeah. Alexandria, I think that there's something very unique in this community here in Alexandria with all of these organizations working together. Maybe other cities do that, but boy, it's the camaraderie here and the companionship and the community support is really something to observe. And how great Act for Alexandria is just such a unique model that they can kind of do that busy work of helping you get funds so that you can actually do the work you need the funding for, because it's very difficult to do both of those things at the same time. So the work of Act for Alexandria is really essential in that way. Patrick, can you talk a little bit about how Spring to Action has helped your organization?
Yeah, sure. Again, like you said, Susan, it is sort of a convener of the Community Act. It's been helpful to be able to understand and coordinate our services with everybody else, so we're not duplicating the efforts. And as Jennifer was saying, everything takes longer, everything's harder. Reaching out to students that you used to see on a regular basis in the school. Now it's phone calls, it's virtual clubs, it's technology. There's a digital divide. So the Spring to Action and ACT has been helpful to my organization to be able to give us funding, to be able to make sure that everything that used to happen in a school building can happen, at least to some extent, virtually. And then there's also just that physical connection that you need by having these mobile markets, by having food, by having opportunities to bring people together safely. And ACT has just been really instrumental in that. It's really good to be able to know that there's that sort of convening voice and be able to get their expertise on how best, like where does CIS fit into this? A lot of my site coordinators are bilingual. They know the West End very well. They know some families that maybe Jennifer didn't know, or Bassam would, everyone has a piece of this puzzle. And I think ACT has done a good job of really trying to bring us all together to make sure that, what takes so much longer is targeted.
Yeah. Yeah, and again, so that they're helping out on the fundraising portion, so you guys can do what you do best, which is actually serving the communities,
Right.
and the charter under your care. Patrick, do you have any? Can you speak a little bit to some of your goals for this year's Spring to Action that's happening in 2 weeks on Giving Day, April 28th. Do you guys have plans for some of those funds, or just moving forward plans that you'd like to do?
Well, I mean, it's such a strange time on the sort of fund side, the fundraising side. There's a mix for us. We're a nonprofit that works on both getting public dollars and private dollars, and everything has been so disrupted that just to be able to sort of communicate what we're doing and where we want to continue to do with funds is really important to us. Because of a lot of our work is starting to happen outside the school building. Obviously, we've really developed a lot of sort of family parental engagement, everything from sort of digital literacy classes with adults to mobile markets, to working with housing developments to bring in information around whether it's health or education in terms of what's coming forward. So really, for me, it's being able to sort of essentially continue to sort of have that sustained connection in the community once these buildings open. We've been at Hammond Middle School for the last 6 years. We now have connections at Ramsey Elementary, and we have a presence now at Alexandria City High School. So these funds will allow us to get a little bit deeper into those communities and to really kind of, again, link all these pieces together to make sure that we bring the right information and the right resources to people that need it most.
Oh, that's terrific. And that was a very smooth Alexandria City High School of calling it by the new name. That was very good. I like that. Basim, I'm going to go to you next. Can you speak to plans that you have for 2021 and how Spring to Action is going to help you to achieve those goals?
When people ask us about plans, the COVID pandemic has obviously shuffled everything around. And to some degree, it's difficult to predict because, you don't know where things are going to be in a few months. Although I will say more recently, with the way the vaccine rollout has been going, there is hope that by the summer or the fall, life will be returning to, closer to normal than it has been. So there is a light at the end of the tunnel. For us, immediately, obviously, the vaccine rollout is our most significant priority. We want to make sure that we get vaccine into the arms of as many of our patients as possible. But in addition, underserved communities more broadly in our service area. We want to make sure that those communities who might not have access to information or might not have been able to sign up through an online portal, that we have the opportunity to engage with them, to ensure that we're able to answer whatever questions they have about vaccinations and then give them access so that they're able to get a vaccine quickly, so that they're protected, so that their families are protected. So for us, the vaccine rollout is a significant priority. But as we get through that, it's also being able to provide primary care. And our services are broader than just primary medical care. It's also dental care, mental health, HIV care, medications. So the needs for our patient population on the back end of the pandemic will be significant. You've obviously heard in the news of people putting off being able to get medical care, or obviously dealing with the mental health fallout from the pandemic. So we have to be prepared to meet these needs in our patient population. So funding that we get will obviously go towards that. So in the short run, the vaccine rollout, but in the longer run, and by longer run, I mean over a few months or over the next year, being able to make sure we have capacity to provide healthcare to our patient population and underserved communities more broadly that need it.
Sure. What can the Boston? I'm going to stay with you for another minute. Is there anything besides donations, which of course I know that everyone would hope that people can be as generous as they can this year. Besides donations, is there another way that the community and public can support you and your needs? Do you need volunteers in some of these, efforts to get those underserved communities vaccinated? I hope everybody understands that the more everybody is vaccinated, the better for everybody else. So is there anything that the community can do to support you?
I think more broadly speaking, the public health campaign to try to encourage people to get vaccinated
is really important, because a lot of that work is done at a one-on-one level. So the community can support us by just encouraging the people that they know, the people that they come into contact with, especially if it's anyone from, the underserved communities or the communities that have been more impacted, just to encourage them to get vaccinated, to refer them, whether it's to us or to the health departments. And then the other piece is just, to put that caution out there that even though we would like to think that the pandemic is over, or things, are back to normal because the vaccine rollout is going at the pace it is, the reality is it's not. So we still need to be careful. We still need to encourage people to wear masks. We still need to take this seriously, because the last thing we want is for people to get sick at this point when vaccines are available. So, really, really being able to do that more broadly helps our efforts. And more specifically for us, yes, we do look for volunteers to help with vaccination and other efforts. We're obviously hiring people for different positions, especially a lot of our clinical and patient care roles as we try to expand. So those are some ways that people can support us as well.
Terrific, terrific. Can you give your website address, Bassem, in case anybody is watching and wants to kind of sign up and see how they can help?
Sure, it's Neighborhood Health VA, all one word, .org.
Great. neighborhoodhealthva.org. Okay, terrific. Okay, Jennifer, I'm going to go to you and ask you about your plans for 2021. I know you already have quite a few programs going on right now, but just wanted to ask you about your plans and how kind of the how essential and what the funds for Spring to Action help those plans go.
Yeah, well, we're hoping, I don't know that we're going to go back the same way we came, but we're hoping to continue to reopen some of our programs and to serve in some new and creative ways. So thinking about our transitional shelter, we've been at half capacity. So we're looking forward to bringing that up to full capacity, hopefully soon. And then we also have a furniture program that's been on hold. So once we feel like it's safe to go back into people's home to collect donated furniture and get it to people who need it, we would really like to do that. You don't think about it, but a lot of groups don't hand out mattresses. So we collect mattresses and we get them to a family who needs it. So sometimes people are able to come out of shelter into a home, but they don't have any furniture or those essential items. So we're working on trying to get more of those out as it's safe to do so. We've also started working in partnership with a few other groups to do the Alexandria Eviction Prevention Partnership, where we're helping people navigate to eviction prevention resources, and financial resources. We've also, as part of that effort, started working with AHD to register people for vaccines. So we're really trying to think about how can we either engage with other organizations to get people services they need or reduce some of those barriers for services, whether that's having the ability to sit down with someone one-on-one who can help people understand why it's okay to fill out a form and what to say when they call, or thinking about what technology barriers they have. It's a lot easier for some people to do things on a phone, but they might not have access to internet. So we're looking at some of those barriers and what we can do to meet other organizations where they are and just help get people to the services that are existing. And on the food side, we're hoping not to do quarantine food as number goes down. So right now we've been doing this reserve. So people who are in quarantine, who are food insecure, do receive food from us. And we've been very busy with that at times because you don't really see it. But we're seeing those numbers go down, and we're hoping that's something that can eventually be depleted as people are getting healthier. And we will continue needing more food. We just see our numbers remaining high. Even as more food distributors open, the number of people coming to get food has not really decreased significantly.
Okay, great. Yeah. And your website address is?
It's alive-inc.org.
Okay, alive-inc.org. Okay, and Patrick, I didn't give you a chance to give your email address, your website address, if you could.
Sure, it's cisofnova.org.
Okay, cisovnova.org. cisofnova.org. Okay, terrific. Well, thank you all so much for joining us today, coming on live in the middle of your very busy day. I know you guys all have plates that are too full, and but we appreciate learning a little bit more about what your organizations do, and more especially how much you depend on Spring to Action and all the great funding that comes in, because they are just such a wonderful organization. And I don't know if anybody wanted to say anything in closing. Patrick, why don't we start with you?
Yeah, I would just echo, we all know what the short-term goals are in terms of getting, COVID and health and getting back, but don't settle back, especially in the world of education. Don't settle back as a community to what we left. There's a lot of inequities in our school systems that need a really sort of consistent community engaged in it. It takes a shared responsibility, and I would just ask everyone to really don't let up. Let's take this opportunity, as disruptive as it was, to hopefully make sure that we continue to be vigilant and making sure that everyone gets what they need to be successful.
Excellent. Great advice. Yeah, like I was saying before, there's a lot of things that came out of this pandemic that we're doing differently now that can stay. There's no need to go back to everything exactly the way it was. Jennifer, was there anything in closing that you'd like to add?
We're just so grateful for this community and for all the support. We've had volunteers come out. We estimate about 1,200 incidents of volunteer service, or people volunteered this year. And that's huge. And we just had such a generous outpouring from last Spring to Action and all throughout the year. People keep calling to ask, how can we help? And then it's just nice to be there, and I'm really appreciative.
Excellent. Yeah, we're very lucky to be in the community that we're in. And Bassam, did you want to have any final closing thoughts?
On a similar note, we've the response from the community and the generosity of our community and ability to rally together has been really inspiring, and we're so grateful for that. In addition, I would be remiss if I didn't mention that I've just been very grateful to the way our staff has pulled together and really stepped up this pandemic, and it's just been wonderful as someone in my position being able to see that. And I've just really enjoyed seeing the way that that's happened. So grateful for the community and the support that they've given us, and also really grateful for the way that our staff has stepped up as well.
That's terrific, and I'm sure your staff appreciates hearing that, because it's easy to keep going in the trenches and just getting your work done, but it's always nice. A little gratitude goes a long way, right? So thank you so much, Bassam, for mentioning that. Patrick and Jennifer and Bassam, thank you so much for your time. Good luck for Spring to Action this year, and I wish all the best for all of you. Thank you so much.
Thank you.
Okay.
Thank
And
you.
to everybody else out there, thank you so much for watching. And remember, as much as you can, to be the good news in someone's life.